Okay, so the excitement is quite palpable on this side as well. So welcome to everyone. My name is Shabir Madhi. I'm the Dean of the Faculty of Health Sciences. Unfortunately, I probably haven't had opportunity to engage with almost all of you for the past year since when I've been in this position. But it behoves me to first and foremost apologize to you. Apologize to you because I'm sure that after having traveled this long journey, and for some of you, at least as one person I know, this journey probably started way back in the 1990s. And that person is today graduating as well. A truly remarkable spirit and intent to actually achieve a goal. But for the rest of you, obviously you've set out on a goal a few years ago, some perhaps even a decade ago, and today culminates in you having achieved that goal. So it is disappointing that the university is unable to host a formal in-person graduation ceremony. I'm sure that all of you are disappointed and all of your families are disappointed, and so am I. But unfortunately, we live in very uncertain times, largely because of COVID-19. And we certainly didn't anticipate having a resurgence as early in December as it arose in Gauteng, which obviously led to the postponement, in a sense, of the graduation ceremony, or rather moving it virtually. But at the same time, we thought it appropriate in the Faculty of Health Sciences to make every possible attempt to recognize you for your achievements. And hence, we asked permission from the university for us to be able to hold a ceremony in person, which is an oath-taking ceremony, really for you to commit yourself to what you've spent the past few years working towards, and that is to making a difference. to making a difference to yourself, to making a difference to your families, your partners, as well as, most importantly, to making a difference to society. So today it's a real pleasure for me to welcome graduates from a number of different courses offered by the University of Witwatersrand. And as most of you know, graduating from this university might seem like a small accomplishment to some, but you stand amongst the elite. You stand amongst the elite insofar as WITS probably ranks only second to UCT and probably first in some of the rankings in the Faculty of Health Sciences. But in addition to that, we amongst the top 2 universities on the African continent when it comes to the Faculty of Health Sciences. In addition to which, we're probably in the top 100 of universities globally when it comes to the Faculty of Health Sciences. So a qualification from WITS, even in this day and age, does mean a lot and really places you in a very competitive position when exploring your further opportunities in your careers. So the graduates that we'll be honoring today include the Bachelor of Health Sciences Honors in Biokinetics program, the Bachelor of Oral Health Sciences program, Bachelor of Clinical Medical Practice program, Bachelor of Pharmacy, Bachelor of Nursing, Bachelor of Science in Occupational Therapy, Bachelor of Science in Physiotherapy, and last but not least, Master's and Bachelor of Science in Surgery and Medicine and Surgery, the MBBCH program. So to all of you that have been able to join us in person, very much thankful for your attendance. And for those of you that are joining us online, I think there's about 200 people that are joining us virtually. Welcome to you as well. So I think before going to the oath-taking ceremony, which is a fairly straightforward ceremony, I'm just going to make a few remarks in terms of where we are as a university, where we are as a country, as well as where you should be as individuals. So COVID-19 obviously has been disruptive globally, and none of us probably would have thought that we would have experienced what we've experienced in the past 21 months during our lifetimes. On a personal note, my background is I'm a pediatrician by training, and after having qualified as a pediatrician, I pretty much went into research, and I've been doing research on vaccines for the past 27 years. But nothing prepared me and nothing prepared other scientists for what was coming our way. And it really speaks to what does your qualification mean at this point in time, and what can you expect of yourself moving forward with regard to remaining relevant to the program. So in the past, scientific literature probably doubled on a particular topic every 2 to 5 years, and maybe every 5 to 10 years for some subjects. With COVID-19, the generation of knowledge, the doubling time, has probably changed from an average of about 2 to 5 years to probably around about less than 2 weeks. Which means that if anyone has been keeping up with the literature until before you started your exams, by now your knowledge of COVID-19 is completely outdated. And that's a hard reality. And that's the reason why South Africa and many other countries made large number of mistakes. In retrospect, hindsight is obviously 2020. But there were a number of mistakes we made in terms of how we went about trying to contain the pandemic, the type of actions that we imposed on society. And to some extent, unfortunately, even to date, I see all of you are wearing face masks, which is great. But at the same time, it sort of speaks to an issue where we're simply unable to keep up with the science. And government certainly hasn't been able to keep up with the science. So in this day and age, at this time of the pandemic, knowing what we know about how the virus spreads and what are the major risk factors for transmission and acquisition, we shouldn't be talking about things such as quarantine. We simply probably shouldn't have isolation for more than 3 to 5 days for individuals that are symptomatic. We should be hosting most of our gatherings outdoors as we are today, with a comfort that it's extremely unlikely, even if you weren't wearing a face mask, that you are going to get infected. Because now we've known, unlike at the start of the pandemic, where we thought you are welcome to take your mask off if you want, but don't breathe into each other, that's all. But we're definitely in a different space. And I think the message here is that it's not about trying to change overnight what we're wanting to do, but if you want to remain relevant, and if you want to do justice to your patients and the people that are going to entrust their care to you, You cannot rely and depend on the knowledge that you've accumulated over the past 4 to 10 years. If you do that, you'll be doing an injustice to your patients, to the people that are seeking your care, and you'd be probably doing an injustice to yourself in that what really is exciting about medicine, what's really exciting about the health sciences, especially in this day and age, beyond COVID-19, which has changed the manner in which we think about research, how we go about doing research, how we collaborate with each other, and the importance of research as a career pathway. Beyond that, we're entering into a phase of medicine which is going to be completely different in 10 years from now compared to what you're doing right now. So right now at the Faculty of Health Sciences, which is a bit too late for you, there are 2 important initiatives which we're embarking on, and in particular for the MBBCH program, as well as the Bachelor of Health Sciences program. And that is to start delivering a curriculum which is more in keeping what is required of practitioners in the 21st century. So in 10 years from now, I would be surprised if you've got a general practitioner that wouldn't be making use of AI to come to a diagnosis. That is already being rolled out in the National Health Service in the UK. In many other countries, the first port of call of consultation is not your GP, it's actually going online. And pretty much you've got an algorithm that determines with the probability of you having X, Y, or Z. The type of screening that's taking place from the time of birth, which predicts what your outcome would be in the years to come, your susceptibility to underlying chronic diseases, your susceptibility to cancer. Those are the type of things we haven't necessarily been teaching at the university up to now, but that is where you need to head to. Not going to have benefited from the changes in the curriculum that are currently underway in the Faculty of Health Sciences. And it really speaks to the issue that, yes, the Faculty of Health Sciences has provided you an education which I truly believe does equip you over the next few years. But again, to emphasize, if you want to remain relevant, you'd be doing yourself a disservice by not keeping up with the latest scientific literature in whatever field of interest exists in your mind. If you don't keep up with the scientific literature, in 5 to 10 years from now, you might still be in practice, but you're really not going to gain the full pleasure of being involved in the health sciences as a career. So in addition to that, another important initiative, again, and this is something which I have to take an opportunity to appeal to you, is when many of us finish our career, our undergraduate studies and our honors as well, it's been a long journey. And the last thing on your mind is wanting to study further. But again, you need to just obviously pause, take time off, take 1 to 2 years or 3 years, depending on your internship and your community service and everything else. And then you need to ask yourself, and it needs to be a handful of you. It needs to be a handful of you to be impactful on the lives. It needs to be a handful of you to be impactful on the lives of millions of people, not just in South Africa, but what I'm referring to is the need for us to inculcate at an undergraduate level, which is another initiative which we're only unfortunately starting now, which will kick in.
Crazy the way.
And that is to have an intercalated PhD MBBCH program, which really sort of sows the seeds of research at an undergraduate level. It's simply unrealistic for us to expect people to become passionate about research after we've completed 6 years of undergraduate training, 7 years if you go into the GEM program, another 3 years of internship plus community service, and then another 4 years of registrarship. By 12, 15 years later, very few people are keen on pursuing something which is completely foreign to them. And what I'm appealing to you is that as you go into your internship, you need to look for opportunities. Internship is a difficult period, probably less difficult now than when I was interned, and we used to spend about 36 hours on the run without any break. And I used to spend 1,200. And this wasn't too long ago. It was by the time we were born, probably 1997. So things have changed. But at the same time, I think as an intern and as a community service, and when you go into your community practices, it provides you an opportunity, and those initial years needs to be really informative to you. It provides you an opportunity to really understand what it is that you're truly passionate about. And what you need to do beyond that is really build on a passion. There's a need for people to be general practitioners, absolutely no doubt of it. There's a need for people to be generalists, even after they specialize. But amongst you, there needs to be at least a handful that are really wanting to push the frontiers, the boundaries of knowledge, and to really become the type of alumni that this university has produced, including Nobel Prize winners, laureates. So what I'm appealing is that as you're going into your internship, as you're going to your community service, just keep at the back of your mind that your training hasn't ended. In fact, it's a start. We've just given seeds, we've sowed the seeds for you to really get the grasp of what health sciences is all about, be it dentistry, be it physiotherapy, occupational health, medicine, whatever it is. We've really provided you the seeds. And it's really up to you now to take that baton and to move it forward. And like I said, hopefully many of you will remain on in this university in one capacity or another. And last but not least, all of you should be part of this university. So the one other thing is somewhat a fail in this university, unfortunately, and if you're really trying to, and I appeal to you to really take it to heart, is really to have a spirit of you being from Wits and to see yourself as being part of this collective of alumni. And being a part of a collective of alumni goes beyond just saying that you graduated from Wits, is to see how in the future you would be able to create opportunities for other undergraduates to have a better experience than what you might have had, as well as fly the flag of Wits wherever you might end up going into the future. So with those few words, once again, congratulations to everyone. Well done. Highly recognized on everyone's part, and see that your families, your partners are not here to be able to witness it. Hopefully in April, for those of you that are still around Johannesburg or that are able to come this way, we're hoping to be able to arrange face-to-face sort of graduation ceremony. And hopefully by then COVID would be beyond us. And in fact, if you want to know a little more about COVID, let me give you some thoughts on COVID rather. So I can't not speak to someone and not speak about COVID for the past 21 months. So let me give you some thoughts on COVID. So we actually at the turning point in this pandemic. Things have never looked brighter than the past.
Leslie Kafka.
That might sound strange to you because your graduation ceremony has been cancelled. We see the rest of the world locking down Southern Africa, preventing travel to and from South Africa. We see everyone else in every other high-income country jumping and trying to offer third doses of vaccines when less than 7% of people in low-income countries have even received a single dose of vaccine. Healthcare workers remain completely unprotected. People with underlying medical conditions remain completely unprotected simply because they're unable to gain access to vaccine. Yet we see all of these high-income countries. Today, there'll be about 40 million doses of booster doses of vaccines that will be administered in high-income countries. The virus is going to be with us for the rest of our lifetimes. But what it is going to become is a virus which hopefully doesn't cause any more deaths than what seasonal influenza would cause each year, and probably less deaths. In South Africa, each year, there's about 10 to 11,000 people that will die of seasonal influenza alone. In the 21-month period, like I mentioned, of COVID-19, we lost 260,000 people from COVID-19. So we're probably now at a turning point, and in the next 2 to 3 weeks will be highly informative. And that's the reason I said, you pretty much can take off your mask, because be rest assured, if you haven't been infected with Omicron, you're going to be infected, especially if you're going on vacation and you're going to the pubs and clubs and bars, you're going to get infected. I just become comfortable with that knowledge, but most important, make sure that you're adequately protected. Wear your mask. No, sorry. Wear your mask indoors, yes, if you're in a crowded, poorly ventilated space. Most importantly, make sure that you're fully vaccinated. And by fully vaccinated, I do not mean a single dose of J&J vaccine. That is not fully vaccinated. You need to have at least 2 doses of some vaccine. So with that much more lengthy speech than I planned to give, once again, congratulations. And I will move on to the oath-taking ceremony part. Okay, so what I need you to do for our oath-taking ceremony part, if you can please rise. sorry, if there's any academics in the audience, if you don't mind coming down and joining us down here. Okay, so for our oath-taking ceremony, I think you should just move 1 meter apart and take your mask off.
Okay. 1 meter apart and take off the mask.
These are very compliant. Okay.
Yeah.
Okay, so if you can start. So if you can please repeat after me. As a health professional graduate of the University of the Witwatersrand, I solemnly pledge that
As a health professional graduate of the University of the Witwatersrand, I solemnly pledge that
I will dedicate my life to the service of humanity.
I will dedicate my life to the service of humanity.
I will exercise my profession to the best of my knowledge and ability in accordance with sound health practices with compassion, conscience, integrity, and humility.
I will exercise my profession to the best of my knowledge and ability in accordance with sound health practices and with compassion, integrity, and
The health and well-being of all persons entrusted to my care and the well-being of the community will be my first consideration.
be all persons entrusted to my care and the well-being of the community its consideration.
I will respect the autonomy and dignity of my patient and will not knowingly do anything to their detriment or prejudice. I will not permit consideration of age, religion, nationality, politics, race, gender, sexual orientation, disability, disease, lifestyle, economic status, social standing, or any other factor to interfere with my duty to my patient.
Consideration of age, religion, nationality, politics, race, gender, sexual orientation, disability, disease, lifestyle, social status, any other factor to interfere with my patient.
I will not improperly divulge anything I have learned in my professional capacity. I will uphold and defend my professional independence. I will advocate for human rights and will not violate such rights and civil liberties, even under threat. I will conduct research on patients only in accordance with sound ethical principles and with the approval of a formally constituted ethics committee. I will embrace lifelong learning to improve my professional knowledge and skills and will share my knowledge for the benefit of patients and advancement of healthcare. In my relations with patients, colleagues, and others, I will conduct myself as becomes a member of an honorable profession. I make this pledge solemnly, freely, and upon my honor. So class of 2021, congratulations, well done, highly deserved.
Good afternoon, everyone. Welcome to the Department of Nursing Pledge of Service ceremony. As you're taking an oath, committing yourself to serving humanity, it is important, very important, that you develop understanding of the meaning of the lamb. The lamb in your hand is the symbol of nursing. The lamb is a symbolic interpretation of the philosophy of the nursing profession and remind us that nursing practice should be the light guiding humankind towards health. The lamp in your hand symbolizes your commitment to develop this noble profession and practice it according to the sciences, which are the building blocks of all health professions. The lamp indicates that you have declared yourself willing, underline that, willing to practice according to the legal and ethical framework of the nursing profession, and that you are prepared to serve humanity with integrity, knowledge, and compassion. The lamp, furthermore, symbolizes your willingness to get into the skin of the patient and be the eyes of the blind entrusted in your care, the feet of those who cannot walk, the hands of those who lack the strength to do for themselves, the comforter of those who grieve, the protector of those who are helpless and vulnerable, the mind of those with impaired consciousness, the coordinator of the patient's care and treatment, the advocate for the rights and dignity of those entrusted in your care. The lamp confirms that you, as a professional nurse, are willing to abide with the code of conduct, and that you undertake to be a role model to aspiring nursing professionals and all other people involved in healthcare. With these words, I give you the call of nursing. May the oil of knowledge and compassion burn brightly in your professional lamp. Thank you. I'll now hand over to Dr. Mafuta, who's going to lead you with the reading of the Pledge of Service. Thank you.
Good afternoon. I'm going to lead you as Dr. Chabalala have said. I solemnly pledge myself to the service of humanity and will endeavor to practice my profession with conscience and with dignity. I will maintain by all means in my power the honor and noble tradition of my profession. The total health of my patients will be my first consideration. I will hold in confidence and all personal matters coming to my knowledge. I will not permit consideration of religion, nationality, race, or social standing to intervene between my duty and my patient. I will maintain the utmost respect for human life. I make these promises solemnly, freely, and upon my honor. Congratulations, nurses of 2021.
Take your mask, huh? It's yours. Thank you, Dr. Mafuta. On behalf of the Department of Nursing Education, I would like to extend a hearty vote of thanks to all of you for honoring us on this day, a day where we celebrate excellence in nursing. Can you please give a round of applause to all the people that are joining online? Then I would like to thank the graduates for being here today on a Tuesday morning. I know it wasn't easy. Congratulations for your achievement. Please remember that this is the beginning of greater things to happen. You have not yet arrived. You must come back to register for master's degree in the Department of Nursing Education. And to our nursing leaders, the role models, that is the mentors that are watching online, that you have nominated, for their role in your professional development. We salute you this morning, or yes, this afternoon. We are today because of you. Your commitment, dedication, patience has impacted the nursing generations, and hence this occasion today. Thank you so much. We are all inspired by your contribution in nursing. Finally, on behalf of the department, I would like to take this opportunity to thank Prof. Shirley Schmalgraber, Prof. SS, that is watching online. Prof, thank you for all the years that you have been our head. You saved us from being headless chickens without a mother when Prof. Marie retired. And by the way, she's retired, but not tired. Prof. Marie is still actively involved in the department. Prof. Shirley, you are one of the nursing leaders who is hands-on and committed to raising standards in nursing. Your zeal and earnest endeavor in seeing more and more nurses achieving academically and excelling is amazing. Thank you for being an excellent mentor and a master of excellence. May the good Lord, Prof. Shelley, grant you what you desire in 2022 and onwards. Thank you. Finally, Mrs. Apfel, Prof. Mabundla, colleagues, thank you for making this event a success. Thank you very much, and God bless you. Thank you. Please remain standing. You're going to come, you'll come forward, put the lamps, and then you're going to sign the pledge of service. Thank you. Okay, colleagues, as you are collecting the certificates, can I have your attention? Colleagues, the reason why I'm calling you colleagues, it's because you're going to graduate, you have graduated, and yes, we are colleagues. All right, I'm going to announce quickly announce the 4th year prizes, and just to make you aware that prize giving will take place sometime next year. But I just want to, arouse your excitement. Brittany Parker, she has won 3 awards. The first one is the Barbara Robertson. This award is for the candidate who achieves the highest mark in the final year of study in both the hospital and the community aspects of the theoretical component of the course. And then the second one is the Henrietta Stockdale. Congratulations, awarded to the student who achieved the highest level of professional maturity during the 4-year nursing degree. The Elsevier Award, it's for the top comprehensive nursing student. Can we give her a round of applause? And then we have Stembile Mtiane. Stembile, where are you? Can you wave? Where's she? Can you wave? Stembile. She has also won 3 awards. Henrietta Stockdale, awarded to the student who achieved the highest level of professional maturity during the 4 years nursing degree. And then the Nestle, awarded for the best final year student in women's health. And then the third one is the Pegasus Prize for being the top overall student in women's health in the 4th year of study. A round of applause, please. Okay, then we've got Fano, Brightness Chikobela. Where's Fano? Come on, Fano, we want to see you. Yeah, just stand there, just stand there. Fano has won 2 awards. The first one is a prestigious award, which is the Joggear Memorial Award, awarded to a final Bachelor of Nursing student who has maintained a high academic record and a high level of clinical competence in professional nursing. Can we give it? Okay. And the second one is the Tara Floating Award, awarded to the graduate in nursing in excellence for excellence in psychiatric nursing theory and practice in the 4th year of study. A round of applause. Natanya Joseph. Where's Natanya? That is the top and the most prestigious award in the university. It's a very, very important one. It's called Raymond Marguerite Dart Award. This is awarded to the most, did you hear that one? Most distinguished candidate who has consistently mean from 1st year, 2nd year, 3rd year, and 4th year, performed well. Performing well means obtaining more than 75%, passing every year with distinction throughout the 4 years of study in the Bachelor of Nursing degree. Can we please give her? Okay. And then we've got the last award, the Basil Bennett, awarded to 2 students, Viela Mbalula and Ntabiseng Tsotetsi. Where's Ntabiseng? Can you please stand there in the center? Can you please stand there? It's awarded in recognition of high level of clinical competence in women's health clinical exam. A round of applause. And as I've mentioned that these will be, awarded properly next year, sometime in April, May. Thank you, everyone.